So we have with us Dr. Radley Ramdhan, and he completed his Bachelor's of Science in Biology at Barry University in Miami, Florida, earned his Master's of Science in Acupuncture and Doctorate in Naturopathic Medicine from the University of Bridgeport School of Naturopathic Medicine. While pursuing his studies, he served as a specialist in the United States Army Corps of Engineers, New York Army National Guard for 6 years. It was through his military experience that he developed a special interest in working with post-traumatic stress disorder patients, as well as seeing his colleagues. And as a result, completed his thesis on understanding and treating PTSD using naturopathic medicine. Dr. Radley served one deployment in support of Operation Inherent Resolve in Kuwait and Iraq. And he's co-authored 2 articles published in Naturopathic Doctors News and Review. I'm so excited to have him with us today. And with that, I'm going to turn the presentation over to Dr. Radley Ramdhan, and hopefully he can help us understand this complex issue and how naturopathic medicine really can make a difference. So with that, I'm going to make my face go away, and I'm going to mute myself, and I'll see you on the flip side. Thank you.
All right, thank you, Dr. Joanne. So my story is there, and Dr. Joanne told it pretty well, so I don't need to go over that again. So I'm going to start with PTSD by the numbers. As we all know, June is it's PTSD Awareness Month. So in terms of some statistics, based on the US population, 7 to 8% of the population will have PTSD at some point in their lives. 8 million adults during any given year, which is a very small amount compared to the amount of people that go through some type of trauma. Over a lifetime, 10% of women will develop PTSD, while 4% of men have developed PTSD. In terms of numbers based on the military and veterans within the US, 11 to 20% of veterans who served in Operation Iraqi Freedom and Operation Enduring Freedom, 11 to 20% have been diagnosed with PTSD in a given year. Those that served in the Desert Storm, 12% in a given year, and in the Vietnam War, 15% currently diagnosed, and an estimated of 50% that have had PTSD throughout their lifetime. So I'm just going to jump right into it with the naturopathic approaches to PTSD. As we all know, there's 6 principles of naturopathic medicine, and with any patient that walks into your room, you could pretty much use these 6 principles to figure out ways to approach each patient individually. So first, do no harm. You want to work with the least invasive techniques, select treatment modalities with the least side effects for your patient. In terms of for PTSD specifically, there's social and family-based treatments, behavioral treatments, imagery-based treatments, art, EMDR, EFT, acupuncture, homeopathy, herbal medicine. In terms of doctor as teacher, you want to educate your patient. You want to educate the family of the patient, and you want to educate people who are at-risk populations. So talking to patients about it, if you know they're going on a deployment or they're in any type of services that potentially could be at-risk populations, those are the times you want to talk to them about PTSD, educate them about it as much as you could. Identifying and treating the cause. It's basically identifying and addressing risk factors, understanding that there's an imbalance in the autonomic nervous system, and people are stuck in fight or flight state, and it's all because of them trying to protect themselves. So there's nutritional support, herbal medicine, craniosacral therapy, meditation, yoga, biofeedback, exercise, and acupuncture, just to name a few. Next is the healing power of nature. You provide the body with the necessary nutrients, mental, emotional, and physical support. You remove toxins that could potentially act as a trigger for them. That would actually work as sort of removing toxins within their environment. And then giving the body its time to heal. With everything, you need that time to actually heal from it. Treating the whole person. With PTSD, you have to understand there's a big component of individuality. Doing a detailed intake would help you find that every patient's different. Some patients have different stories. Some patients have very similar stories, but their response are very different for how they present. So understanding individuality will play a huge part in PTSD. Also, in terms of the way that they respond to treatment, within your intake, you could figure out ways that may work best for the patient just based off of the intake that you do. In terms of prevention, you want to address predisposing risk factors for patients. Resiliency training, as I mentioned earlier, with the at-risk population, and then just educating patients about stress management techniques. This could be either before or after they've been diagnosed with PTSD. So prevention in terms of just preventing them from having reoccurrence of symptoms, flashbacks, those sort of things. So there's a lot of risk factors for PTSD. I'm just going to take a second just to get this up, sorry. So with risk factors, there's different types of risk factors in terms of nutritional risk factors, genetic risk factors, environmental risk factors. So neurochemicals, there's increase in dopamine, increase in norepinephrine, decrease in concentration of 5-HT, decreased GABA activity. In terms of anatomy, increase in the activity of the amygdala, reduce anterior cingulate volume. Genetics, there's different SNPs that they've done research and seen that they play a part in the development of PTSD. So for example, the SNP in ADCY-AP1R1, it's only found to be a risk factor in females. In terms of nutritional deficiency, there's amino acids, tryptophan, tyrosine, phenylalanine. In terms of vitamins, there's B1, B5, B6, B12. There's different essential fatty acids, DHEA, 5-HTP, phosphatidylserine. They all play a part in cortisol modulating that could potentially create that risk factor for people developing PTSD. Also, patients who have had multiple exposures to traumatic events could actually play a huge part in developing PTSD. It don't have to be the same exact type of exposure, but it could be multiple different things. So today it could be they saw something happens, an accident that a person died, and then 2 years later they see something else, and then a year later something else happens traumatic. So it could all play a part in the long-term effect. TBI is known to be a common risk factor for PTSD among military population. Environmental toxicity, pro-inflammatory condition, and anything that compromises the immune system also plays a part for developing that risk factors. So some of the treatment modalities for PTSD, these are all modalities that have been studied or been currently studied either by the VA or by different universities or institutes around the world. So I came up with this chart when I did my thesis and one of my other papers that I wrote, just to kind of summarize everything all in one place. So as you can see, there's different classes of treatment modalities. So there's pharmaceuticals and pharmacologic. So currently, ketamine is something they've been doing a lot of research in the VA with. CBT, yoga, mindfulness, acupuncture, these are all things that the VA has actually been promoting a lot, especially now with the whole, there's 2 acts that recently passed that's trying to promote more whole health initiatives into the VA. So with that in mind, there's a lot of opportunities for us to fall into some of these categories and try to get our foot into the door, or even be able to help patients with PTSD. There's things like meditation, emotional freedom technique, eye movement, desensitization and reprocessing, aromatherapy, homeopathy, flower essence, so back remedies, hydrotherapy, art therapy, doing resiliency training with your patients, spirituality. So these are just some of the treatment modalities for PTSD. So I'm going to jump into the case that I have here today. This is a patient that I've started seeing in March of this year, and she was recommended by her physical therapist for acupuncture to help with pain and her MS conditions. So in 1983, she was diagnosed with MS. She came to me with that as one of her chief complaints, apart with abdominal pain and anxiety. She's been wheelchair bound for 20 plus years. She's had loss of or decreased motor and sensory functions from waist down. Her left ankle is supinated and plantar flexed. She has minimal passive motion in her hip, knees, and ankles. And this is a picture of what her ankles look like. And slightly to an extent, you could see the knees, but she's unable to actually bend the knees beyond what we see in the wheelchair here on her own. So some of her past medical history: she's had meningitis as a kid. She's had treatments for anxiety and depression throughout her life. She's had trouble with insomnia. And as a kid, she's had her tonsils and appendix removed. So when this patient first presented to me in March, I asked her for a list of her supplements. And this is pretty much everything that she's told me. Apart from all of this, she was also on a low-dose LDN. And so what I did with her, I told her that we need to minimize this. I thought that this was way too much. So there's one category that says duration here. It tells you how long she's been taking it. And this is all based off of years. So Mago7, for example, it's been 10 years. She's been on 10 years for Lexington, 10 years for Evening Primrose. And what I did is I pretty much categorized everything for her, just to have her get an idea of how I would like to have her decrease her supplements. So I sort of broke everything down, and I explained to us, we went on with the treatment, that ideally you want to get down to as little as possible, sort of like clear yourself, detox from all of these things, because there is times when certain herbs need stabilizers to keep them good. And if you take too much of it, then it's going to cause a lot of other health issues over time. So my goal was sort of to reduce this list with her. So from a PTSD standpoint, I wanted to cover a little bit her trauma history. She had a lot of verbal abuse from her mother, sexual, physical, and verbal abuse from her father. She grew up in a strict Slovakian culture. One of her punishments as a kid, she was locked in a box. Also, she grew older. Her first child died after birth. So some of her PTSD presentation, she's mentioned being easily irritated. She has lots of anxiety. She's very fearful for her daughters and very overprotective, especially with any male figures, be it father or husband, as the case might be for her daughters. She does have a sense of alienation from families at times. She's had lots of interest in writing and art, which have been things that she's done as a child. And she's mentioned to me one of her sort of traumatic event was her coming back home and her mom and dad making fun of all of her writings, or actually just throwing them all out. So that kind of played a part in it here, and as to why I write as part of the PTSD presentation here. And she avoids the darkness as much as possible because it's one of her stimuli for reminding her of her trauma. She also blames herself a lot for the trauma, and she blames herself for developing MS. So some of the prior treatments she's done neurolinguistic programming, she's done talk therapy, she's done counseling, she's done medication, and she's done meditation to help with her. So as a naturopathic doctor, I utilize the 6 principles, and starting with first do no harm, I had her decrease the number of supplements that she took daily. So currently she only takes Triphala and Mago7 daily. She does castor oil topically with heat on the abdomen and the joint to sort of help with that bowel movement, abdominal pain. And with castor oil, it helps to increase blood circulation and lymphatic flow to areas that you apply it. So hopefully send down inflammation in the joints and eventually get some more motion in there. We've sort of used acupuncture as a replacement for taking daily medication. So now she takes some medication more or less as needed. Her pain meds, her anxiety meds, they all sort of taken as needed by her. We did some writing exercises with her. I gave her a back remedy, and we've made some dietary changes. So initially she's tried multiple different diets. The SOAC diet was the one that she's most recently did, and now we're slowly reintroducing foods into her diet. Identify and treat the cause. You always want to know what's the straw that broke the camel's back. So sometimes it could be something very simple, and like I mentioned earlier, multiple traumas could play a part in developing PTSD, but sometimes it's a straw that breaks the camel's back when it comes to that. So making connections to past emotions, events, and her current presentation. So with her writing exercises, this was something I had to do when I came back from my deployment. Through the VA, I did something called written exposure therapy, and I sort of mirrored that because I'm not fully trained into it, but I sort of used the idea of writing to help the patient get out some of her stuff. So we pretty much did them based off a topic. So I told her, okay, today we're going to write about rebellion. And that was something that while talking to the patient, the topic of rebellion came up a lot. Rebellion from her parents, rebellion from her family, all of that. And as time went by, we started noticing different themes within her writing and talking. And we moved from rebellion to rigidity. And now we're into the area of writing more about flexibility and flexibility within her life, what it means to her from an emotional standpoint and from a physical standpoint as well. So the healing power in nature, you want to give your patient mental and emotional support. So it's taking time to listen to them is important. The back remedy, I've done the NADA protocol with her. She's been doing emotional freedom techniques. She's been doing breathing exercises, been making dietary changes for her and nutritional support. So she does 12 injections every week that I go in, sort of as one of those nutritional supports that I do. So here's a quick picture of what the 5 points are that forms of the NADA protocol. And it's been used a lot for addiction, but it's also been studied a lot for PTSD. So that's why I decided to do it as part of my treatment protocol. Doctors, teachers, pretty much straightforward. It's a lot of it's educating the patient about different things. So with my patient having 30 plus supplements, I'm educating her about toxic burden of over supplementation. Also assisting the patient in making connections to the symptoms. It's not me directly telling the patient, oh, do you see the connection between X and Y? It's more so just sort of helping direct them to make that on their own. Also, it's important as doctors, teachers, to explain to your patients the significance of their treatment course. Partly because you don't want to set up that expectation of, I'm going to do magic and you're going to be fixed in one treatment. So it's important to explain to them sort of like a treatment course. You don't have to give a set time as to where exactly you see that patient would be completely healed or anything like that. So what I do is I give them time. I say, let's try 10 treatments and see where you feel, and we'll reevaluate for that. A lot of it is based off of how long the person has had certain conditions that you want to focus on with that. So treating the whole person, again, doing that detailed intake, asking the right questions is important to get as much information out. Doing acupuncture, doing scalp acupuncture for the MS aspect of it, doing NADA protocol for PTSD, and then doing meridian treatments just to help based off of pain symptoms and other symptoms that comes along with the MS. Also having her do emotional freedom technique, breathing exercises, writing exercises, diet and nutritional support, and detoxing in terms of her coming off of 30 supplements and sort of breaking it down from there. She does, with her diet as well, there's some forms of detox that goes into that as well. So prevention, you want to prevent further potential harm to self through educating patients again and helping them to identify key risk factors, identifying the potential triggers for them. Offering your time and service to your patient is important when it comes to prevention. And listening and reading between the lines is also a huge part in creating that prevention aspect for your patient. A lot of times it's a difficult thing to just open a can of worms when it comes to PTSD. So my advice is don't just jump into it. It's something that you want to take slowly. And if you do open it up, don't just cut your patient off. You have to give them that time to help get it out. Because a lot of times you see where you open that can of worms up and an emotional component comes in and you close it off because you don't feel comfortable dealing with it. And when you do that, you sort of break that trust between doctor and patient when it comes to that aspect of it. So currently with the patient, she's still currently a patient. I see her once a week. So the changes we've seen since March month, she's had decreased abdominal pain to the point that some days she doesn't have any abdominal pain at all. She has better bowel movements. She was leaning more towards a tendency of constipation, and she would go a couple of days without going off, and then she'd have bowel movement. So now it's a little bit more regular with the Mag07, the Triphala, and the acupuncture. She's able to do more with her physical therapist. She's also had increased passive range of motion, straightening of the spine, and increased strength reported by the physical therapist. There's been decrease in anxiety and agitation levels that she's reported. The last 3 treatments ago is when I did the NADA protocol. So the second treatment I had after starting the NADA protocol, she's actually felt a needle for the first time in her leg. Then the second time after that, she was able to feel more needles, and she was actually able to feel the electrical stimulation that we've been doing with that. So I attribute a lot of that to making that change of jumping into treating that PTSD component and utilizing the NADA protocol at that point in time. So I know my case was a lot about MS. My patient came in with MS. So I wanted to talk about PTSD and other health conditions. So some of the common health conditions that we have that you see PTSD being associated with is depression, alcohol and drug abuse, and anxiety disorders. Some of the other things that there's been studies and research shown that chronic pain, eating disorders, insulin resistance, metabolic disorders, autoimmune conditions, sleep disorders, reproductive issues, respiratory issues, skin conditions, and neurodegenerative conditions. These are all conditions that we've seen play a part with PTSD. So either PTSD has been the start and then these conditions developed afterwards, or the other way around. So I want to give some tips for working with PTSD. It's not always a straightforward case, and not all cases that come to you will be the same. So a lot of times having patience with your patients is important. It's all about the right timing and building trust. I didn't get a lot out of my patient initially because a lot of it was focused specifically on MS and her pain. And over time, I asked the question, I was like, emotional questions. And within the 3rd or 4th time I've seen her is when she started opening up more about personal stuff. And that's how we uncovered the PTSD component for my patient. So it's important with that timing and allowing yourself to build trust with the patient. A lot of PTSD patients are in denial. So doctors, teachers helping reduce that stigma associated with it. It's important. Also understanding that treat the whole person concept, like I said before, because PTSD may not be their chief complaint that they come in with. Also, we have a lot of tools in our toolkit that we could utilize to help patients. And as we've seen before, there's a lot of research that has been done. And that table that I had earlier in the presentation has a lot of stuff that has been researched and currently being researched as well. And understanding individualized treatment is important as well, because every patient that comes in may respond differently to different types of treatment. So a lot of reading in between that lines will kind of help you figure out what works best for each patient. So PTSD among the veteran population, I see it to be a little bit different from PTSD among the civilian population. So I have a picture here of a mortar attack. The first day you're on base and you have a mortar attack, you respond quickly. You get up, you run to your nearest protective area. But then a couple of days into it happens so much that it becomes a normal reaction. You just wake up, my hands and limbs are there, and you go back to your regular routine after that. It sounds crazy, but it is the life that you live when you're there. And it's something that it makes it a little bit of a challenge for veteran population, because you get so used to that aspect of it that when you come back home, it's still a norm within your personality at that point in time. So veterans generally form a very unique bond with each other. Well, some of the things we say is, I did it for the person next to me, and only those that serve would understand what I've been through. So those are some of the challenges you would see when trying to make a breakthrough with a veteran in terms of treating PTSD. Not all will admit it openly or openly show symptoms of it. We have the habit of strength, and you should be the strong one in the family because you're in the military. So a lot of times trying to admit to trauma, it's not always easy for somebody to do that. So understanding the environment before and after is important. Before, in terms of where they were, like I talked about the mortar attacks on bases and stuff like that. And then after, when you come back home, what is the environment for you that you're coming back into? And then while you start treating the patient, what would be the environment afterwards also plays an important part in PTSD and the healing from PTSD. So veterans generally need a sense of purpose, they need support, and they need involvement when it comes to being able to work with them. Hypervigilance is a very common symptom that you see with PTSD patients, and simple things could actually be triggers for PTSD patients. So I'm going to show you a video here of what things are, how simple things affect military personnel when they come back home. So this is a video created by David Lidge Foundation, so I have to give credit to them for being able to utilize this video in the presentation today. So one advice that I had from a PTSD patient that I had when I was in school, she told me that two things happens when you tell your story. You can learn more about yourself, and someone will listen and learn from it. So it's something that you could share with your PTSD patients, or you just as personal story. It doesn't have to be necessarily about PTSD, but telling your story is always helpful. So an important thing as a doctor is to figure out ways to heal thyself. What fills your cup, what energizes you, what depletes your energy. Working with PTSD could take a lot of toll on you because it's a lot of emotions that you have to deal with. Sometimes it brings up personal stuff when you talk to patients, sometimes it doesn't. But at the end of the day, dealing with a lot of emotions can actually take a toll on you. So some of the things I do personally is I have a mini garden that I have. So sort of taking care of plants helps me as one way. Playing cricket and football or soccer helps. Running was something I did while I was overseas to help me de-stress. So I sort of use it while I'm home as much as I possibly could. Listening to music and exercise and working out, sort of the things that I do for myself. So what I like about naturopathic medicine, we have a huge toolkit. As I've shown you before, there's a lot of options of things that we could do. There's different styles of medicine, and everyone has a different liking of what they like to do. So because of that, it gives you a lot of options as a naturopathic doctor. In terms of the opportunity to generalize or specialize, it benefits the both. I've noticed that picking one specialty actually allows more patients with that to come in. But once they come in, it's like I do a full detailed intake and I find out they have X, Y, and Z conditions. So you educate your patient at that point and be like, well, this is what I could do from a naturopathic perspective. Also, as a doctor's teacher and identifying the root cause, those are two main things I like about being a naturopathic doctor. Being able to help patients see the root cause, it's actually really fruitful when you see the patient's reaction to them. So personally looking forward, my goals are to set up an integrative health retreat center in Trinidad. Sort of my 5-year goal. I'm only 1 year into practice currently, so I still have 4 more years, and I'm hoping maybe I could pull it off before 5 years, but at 5 years is my goal at this point in time. I want to have the opportunity to travel and practice, and I would love to be able to work with the veteran population, being a veteran myself. Also, global expansion of our profession. I think around the globe, a lot of people are seeing the need for our profession. So seeing that into the future would be a great deal for me, and I'm pretty sure for everybody else within the profession. So for prospective students and for students who are currently ND students, attending lobbying events, DC Fly, Lobby Day, I feel like is a great opportunity for you to experience the passion of our profession. You see a different aspect of it. You see not only the clinical side of it, but you see something it's hard to actually explain until you actually experience it. So I do recommend students going to these events. The quote, the deeper rooted a tree, the stronger it can withstand any storm. Remember our philosophy as you practice. Remember our philosophy while you're in school, and it's going to help you a lot through that. With my time in school, I stayed a little bit longer than an average student. With my deployment and joining the military while in school, it took me a longer time to graduate than the average person. So with that, I built a network while I was in school. So every classmate I had, every classes that I've been with, I sort of still network with them. So a recommendation to students is build a base while in school, not just with classmates, but also with professors, other healthcare professions. And lobby days are generally a good networking opportunity as well. Also, remember your why. There's going to be tough times being in school, and remembering your why would help a lot in you being able to get through those tough times. Even as a practitioner, at least starting off, you have to remember your why as to why you get into the profession and why you chose this route rather than something else. So they all play an important part in the future for you. And this is my contact information. If anybody has anything, any questions, any comments, please feel free to contact me through any of these means. So now I'm going to hand it over to Joanne again. Dr. Joanne, thank you again for the time, and it's over to you now.
Of course. Thank you so much. So before we start to go into some questions and answers, just wanted to update you on a few of our upcoming events. So we have the role of naturopathic medicine in cancer care coming up on July 9th. We also have food as medicine on Tuesday, August 6th. And next week, I don't see this up there, but we are participating in Health Professions Week live event in Boston. And so if you are in the greater New England area, please feel free to stop by our website or email us for more information. And we'd love to have you as a guest at Health Professions Week Live, which will be held in Boston next week. So with that, we'll go to the next slide. And so if you have any questions that we don't get to today, please feel free to visit our website as well as our email and phone there if anything comes up. So one question I have for you, Dr. Radley, is what made you choose naturopathic medicine as your career path here? What was it that drove you to see this as the best way for you to take your career?
So growing up, I've always been into like herbal medicine. It's been a calling from since I was a kid. I never wanted to go into medicine, to be honest. I just utilized it because I didn't really see myself needing to go to the doctors as much. So that was sort of a stepping stone, but it was not until my grandfather was sick and in the hospital and I saw the healthcare system in Trinidad that I decided I wanted to go into medicine. And I've always told my parents that growing up with me just utilizing herbal medicine, doing hydrotherapy, or what I didn't know was hydrotherapy, but I did it and it worked for me. So I told my parents, I was like, this is what I want to practice. In my undergrad, when I was applying to school, I was looking into osteopathic medicine as well. And somehow the universe sent me a mail from Basseterre University. I had no idea what naturopathic medicine was. But after receiving the mail from Basseterre, I looked into it. I found out about what it is, and I was like, this actually sort of aligns with my beliefs. And that's how I applied to naturopathic medical school. I applied to Basseterre and I applied to Bridgeport, and Bridgeport was closer to home at that point in time because my family was in New York. And that's sort of how I went along that way.
Thank you so very much. There are a few questions that I'll shoot your way. Let's see here. So I know that a number of different questions come up about veterans getting help through the VA. And would you have any advice for veterans who are wanting to seek naturopathic care or gain some of these types of therapies through their veterans' health benefits?
I don't have a list of telephone numbers of people that if veterans want to do, but I could actually try to see if I could get some. I know as veterans, you could go to different veteran centers and there's a lot of options offered there. In terms of some of the things that we do as naturopathic doctors, and that could be one source that leads into figuring out about what we do. In terms of like actually getting the treatment, stuff like that. In terms of practitioners, I only know a couple of practitioners who've been in the military and are currently either students or recently graduated. I know one in Connecticut, I know one in Texas. So it's sort of based off of where your location is. That would help you. I don't know if I'm answering your question completely.
Yeah, no,
but
and I recognize that there are, each VA is, the VA system is starting to roll out whole health programs. I know that they've piloted that at 2 locations in Arizona and in Texas that are looking at much more holistic approaches to patient care at the veteran centers. And so they have started to pilot that at 2 locations so far. Both with naturopathic doctors hired to help roll those programs out. So it's really exciting. Usually what I will tell folks is just be consistent. In spirit of disclosure, my husband had been the chief of staff at a VA hospital for 4 years. And so I was very intimately aware of what was able. I do know that when you have providers that may not be credentialed, there are a number of different ways that you can petition to have that care included. Currently, there are a number of providers that are there or may be covered for certain types of aspects of your care. So I definitely recommend to go back to your VA and and advocate for yourself for the coverage that you need for the most balanced care for yourself.
And I think the biggest issue with getting access to naturopathic doctors in the VA is that we don't have an employment code with the VA. So it makes it a little bit of a challenge to see it.
And what I would say, Radley, yes, I do recognize we don't have the employment code as of now. However, veterans do get care, and they typically will get care outside of the system. So
Yep.
If this is something that you're wanting to explore, I've worked personally with veterans over the years, as of many of my colleagues, and so there are other ways around getting the care that you need. And so I would just continue to advocate for yourself, advocate with your point physician at the VA, as well as work with local NDs to get the care that you really need, because it really does make a difference. I know you shared a patient case. I have seen countless. There was one gentleman I saw who was, again, multiple traumas, HIV positive, and had come in homeless to a center that I was working at. And, the very first moment, he was all bravado. He was, bragging about how many people he killed and how tough he was. And, you could see how much that external bravado was covering up the pain inside and the fear. And I was a student shift, and so I had some students, and I said, you know what, I'll take this one, and you can follow up a little bit later. And we just did acupuncture, and he left. And about several months later, my front desk person says, "Hey, Dr. Y, there's somebody here to see you." And this I looked in the waiting room, and I didn't recognize anybody. And the homeless gentleman, the vet, with the PTSD and multiple traumas and imprisonment, incarceration, you name it, came back clean shaven, halfway home, and counseling young boys at risk. I said I didn't even recognize him, and he just came back to say thank you. And so, I think that there's so much that naturopathic doctors can do for PTSD. So we have a couple more questions coming in here. So with adjusting therapies, if you have, how do you, because you mentioned each case is so individual, how do you adjust the treatment protocols based on the patient who's showing up right then and there?
So a lot of it is listening to what the patient says. So I know one thing that the patient that I had, she mentioned that as a kid she would write a lot, and that was something that happened. Sort of that camel that broke the straw's back is she came back home one day, and her mom, she ran away from home a couple of times, and then one time she came back home and her dad would make fun of her writings, and then her mom threw all her writings away. And I think that kind of what really got to her at some point in time. So ever since that, she stopped writing completely. But I know for myself, like when I came back and doing talk therapy, it did nothing for me. And then until I met with this one therapist, and she's like, I just learned about this therapy called written exposure therapy. And would you like to try it? Because I was telling her, like, I like writing. I rather do writing than talk about everything that goes on. So it's sort of like listening to your patient and figuring out something that they like. So you may find patients that like art. So you could get them into doing something related to that, and then have them talk about it afterward. A lot of it's not necessarily all done in one visit. So for example, the written exposure therapy, today we would write about one aspect of the trauma, and then next week we'd come in and we would discuss how did I feel after writing about it. We don't ever discuss anything within the same day of writing, so you allow yourself to process it a little bit. And then, so it's the same concept I did with my patient. I would give her a topic, have her write about it. The next week when I go, I would read it there with her, because I have the needles in, and needles stay in for an hour. So I don't have anything else to do, and it's a home visit. So we talk about different stuff. So that's how I kind of utilize that. But there's patients that may like different things. Some people, meditation might work because they tell you that they need to find calmness, and you figure out ways to do it. I know when we were overseas, doing mandalas was something we sort of used to get away from everything that is going on. So it's sort of finding out what is a de-stressor for the patient would be sort of an ideal way to figure out which way to go in terms of that.
Thank you so much. There is a question here regarding the literature, and I know that you cited a review of literature and the data and evidence about some of the therapies that you were talking about earlier. Do you have a little bit more to share about the literature regarding some of the therapies you've discussed?
So in terms of a lot of it I found out about the research when I did my thesis. I used Google Scholar and PubMed is what I used to get a lot of evidence. And then sifting through everything, because there's research out there that tells you one thing and there's research that tells you another thing. Also, I subscribe to the National Center for PTSD. They have a journal that they publish every month, and they send out like newsletters for every time they do a research. Also, the U.S. Department of Veteran Affairs, if you go to their website and you look for evidence synthesis program, it actually has a database of everything that the VA has approved as some type of study, or they find that it's sufficient enough evidence to say, okay, mindfulness would help with PTSD or acupuncture would help with PTSD. So it's very specific to PTSD. And it's all about evidence-based medicine. And it's all part of that whole health initiative that they've been doing, that one of the stepping stones for getting it was utilizing this evidence synthesis program. So those would be actual great resources. I wouldn't necessarily advise Google Scholar just because you have to sift through every single thing. I actually like this evidence synthesis program through the VA website because they have everything already compiled there for you. You could search for it and they pull it up and tell you yes or no, and they give you links to the articles and stuff like that. So that's what I found most helpful. Unfortunately, I found it way long after I was done with my thesis.
Thank you so much. Are there any pearls along the way that you have seen in working with trauma patients that you'd like to share?
Could you repeat that?
Sure. Are there any pearls along the way that you've seen either working with your fellow veterans or with trauma patients that you would like to share?
Take each case individually. It's the biggest advice I could give to you. I know for myself when I came back, and I've had a couple of friends when we came back, and talking helps, but there's always other opportunities for things to do. Doing a lot of research and keeping up with the research is helpful when it comes to working with PTSD patients. Also, a civilian PTSD patient versus a military PTSD patient is, to me, it's different. They do have some similar symptomology and stuff like that, but a lot of times that trauma that comes with it plays a huge part in the way that you have to deal with them. A lot of times it's easier for a veteran to open up to another veteran. So making that connection, or if you're somebody that is not a veteran and you've worked with a lot of other veterans, if you could potentially offer like some type of group therapy where you guys all sit together and talk, I feel like that would be the most ideal situation. Or even telling your patient the experience, like I've worked with 6, 7, 10, 20 veterans, and this is what I do. So those are sort of my goals when it comes to working with that. I don't know if I answered your questions completely, but.
Yes, you did. So we're coming up on the hour. I'm not seeing any additional questions coming through, but I really do want to thank you for your time here today and sharing your journey as well as your experiences with our crowd. I know this has been a wonderful experience for everyone involved, and really am appreciative of the time that you have taken for our webinar today. So thank you so very much for joining us.